Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the enzymes and their biomarkers like serum cardiac biomarkers? So for this we write a table. So first we will have to see the enzyme, and when does the enzyme starts to begin to appear in the blood, when does it peak in the blood, and how many days will it stay in the blood normally. Now, enzyme is actually creatinine phosphokinase MB subtype. This will begin in almost 4 to 8 hours after infarction, and it peaks in a 16 to 32. Sorry, it will peak in 16 to 32 hours, and normally it stays for almost 2 to 3 days. And we have LDH, which is lactate dehydrogenase. It begins in 12 to 24 hours. This lactate dehydrogenase will begin in 12 to 24 hours, and it peaks in 48 to 60 hours, and it normally stays in the blood for 7 to 10 days. It stays in the blood for 7 to 10 days. Right? Then, so these two are important tests. Then, right now we will see about each of the tests. Also we have troponin, also troponin T. This troponin T becomes positive in almost 2 to 4 hours. Okay, and this troponin T remains elevated in around 10 to 14 days. Even troponin I also has the similar thing. Okay, fine.
thank you and thank you for watching.